Good afternoon, ladies and gentlemen. This organizational meeting and briefing of the Committee on Health and Demography is hereby called to order. For the information of everyone, the members of the Committee on Health and Demography are Vice Chairpersons, Senator Pia Cayetano, Senator Nancy Binay, and the members are Senator Panfilo Lacson, Senator Risa Hontiveros, Senator Ronald De La Rosa, Senator Francis Tolentino, Senator Amy Marcos, Senator Richard Gordon, Senator Coco Pimentel, and Senator Francis Pangilinan. At this point, let me acknowledge the presence of Senator Panfilo Ping Lacson and Senator Risa Hontiveros. Thank you for joining us today. With our presence, the Chair declares the presence of a quorum. Buti na lang sir na quorum kaagad tayo. Kanina, muntik kaming di natuloy. Kulang yung isa lang. Ganito pala dito, maraming chairmanship, takbo-takbo kami. Konti yung senador. We'll move now to the adoption of the rules. I would like to announce that the committee is adopting and subscribing to the pertinent provisions of the rules of the Senate and rules of procedure governing inquiries in aid of legislation, which was adopted by the Senate. These rules shall guide the operation and conduct of the meetings, hearings, and investigations of the committee. Before we start the discussion, let me first give my brief opening remarks. In recent years, the increasing cost of healthcare has become a burden to the Filipino. Just this year, a report from the Mercer Marsh Benefits 2019 Medical Trends Around the World showed that medical inflation rate will outpace actual inflation in the country and is projected to rise to 13.7%. This makes our medical inflation rate the second highest in the ASEAN region, next to Vietnam's 4.2%. While many of the factors that drive healthcare costs are outside our control, the visionary government of President Rodrigo Duterte is proactive enough to come up with policies that will offset the rising cost of healthcare. In February this year, the President signed the Universal Healthcare Act into law. This measure will automatically enroll Filipino citizens into National Health Insurance Program and expand PhilHealth coverage to include free medical consultations and laboratory testing. They are still finalizing the IRR of this Universal Healthcare Law, and I think it will be finalized within 2 months. Aside from this, other significant reforms that will be implemented over time by virtue of the law include: number one, improvement of health facilities, especially in the underserved areas. Number two, responding to the gap in health workers throughout the country. Number three, strategic engagement of the private sector. Number four, an improvement of the health delivery system. These reforms will surely pave the way for better healthcare access for all Filipinos, regardless of gender, age, social standing, religion, or political affiliation. This is what the President and I have aspired for throughout these years: pangkalahatang access sa healthcare and healthcare para sa bawat Pilipino. Let me add, marami po akong nakikita talagang problema. Napakadami pong hospital, kulang yung mga hospital beds, nakahilera po sa labas ng ward. Yung mga pasyente minsan po ay 2 pasyente, 2 bata sa isang kama. Punta kayo sa Bicol, sa Zamboanga, kawawa talaga. So kaya po isa siguro sa isinulong ko po nung nakaraan, based on my experience po sa Davao, nung mayor pa po si Mayor Duterte. Let me share lang po sa inyo. Alam mo, maraming lumalapit sa Davao City. As mayor, humingi ng tulong medical. Sabi na mayor, pahingi ng tulong. Taga Bukidnon, taga Surigao. Let me acknowledge the presence of our colleague, our mutya ng Taguig, Senator Pia Cayetano, our Vice Chairperson. Anyway, let me continue. Ganito po. Ang daming lumalapit po sa City Hall. Not only in Davao City. In Davao City noon po, as marami namang pondo. So, yung mga taga Surigao, taga Bukidnon, hingi sila ng tulong. Lalapit sila kay Mayor Duterte. Mayor, pahingi naman ng tulong. Sasabihin ng COA, bawal daw kasi hindi po, pera po ito ng Davao City. Alam nyo, doon ko po na-experience. Sabi ni Mayor sa akin, Bong, kung hindi ko man lang sila matulungan, nandito ako ngayon, nakaupo sa City Hall, hindi na ako babalik bukas dito. Sabi niya, hanapan mo ng paraan, bahala ka saan mo kunin yung pera, tulungan mo yun. Hindi ko matiis yung, para sa akin, Pilipino rin sila, nangangailangan ng pagpapagamot. Nung naging Pangulo siya, doon ko po naisipan itong Malasakit Center. It's a one-stop shop po. Kung noong unang panahon, hingi kayo ng tulong sa isang linggo, Lunes, pupunta kayo ng City Hall, Martes, pupunta kayo ng PCSO, Miyerkules, DOH, Huwebes, DSWD, Biyernes, PhilHealth. Ubus yung panahon ninyo, ubus pa yung pamasahe. Tapos papatak pa yung bill, kung may balanse, mangungutang pa yung mga kapatid nating Pilipino. Ngayon, kung may Malasakit Center na tayo, meron na tayong 39 Malasakit Centers all over the country. It's a continuing program po ni President Duterte at in fact, nag-file po ako ng Senate Bill 199 institutionalizing Malasakit Centers which are one-stop shops for indigent and poor patients. And also po, nagpaalam na rin po ako sa mga colleague ko na maglagay tayo ng Malasakit Center dito sa Senate compound para po yung mga pasyente na humingi po ng medical help po sa mga senador, una pong lalapitan nila yung 4 na ahensya ng gobyerno. Kung yung balanse po, yun na po yung bibigay nila Senator Lacson, Senator Pia, Senator Riza, yung assistance. Para po, sana ang target natin to the barest minimum na po yung babayaran nila or wala na po. So yung atin is hindi yung papasa-pasa, iba't ibang ahensya lalapitan nila, isang kwarto na lang po. Huwag po natin pahirapan ng ating mga kababayan, yung mga pasyente. I have always been a staunch supporter of universal access to healthcare. As an aide of President Duterte for more than 2 decades, I have witnessed how the lack of access to affordable and quality healthcare brings a lot of pain and suffering to our countrymen. It is for this reason that healthcare access has become one of my priorities in the Senate. To bolster the government's effort in ensuring universal access to healthcare for all the Filipinos, I have filed and proposed measures addressing various concerns in our healthcare system. To institutionalize Malasakit Centers and ensure their continuity, I am proposing Senate Bill, as I have said, 199 or the Malasakit Center Act of 2019 to encourage public health professionals to provide better services to their fellow Filipinos. I have also filed Senate Bill 200 which seeks to promote their welfare by pushing for their increased salary. Moreover, I am proposing measures to amend the Philippine Nursing Act of 2002 with the goal of improving nursing education in the country, the Barangay Health Workers Act of 2019 to ensure that each barangay will have enough health workers serving the community, and the measure to expand the coverage of the mandatory basic immunization program. For better emergency response, I have also filed a bill seeking to institutionalize an emergency medical services system nationwide. Ito po yung just like the Central 911 system of Davao City. I am sure my colleagues here in the Senate have equally important measures that will strive to study and pass this Congress. Allow me to reiterate, healthcare must be treated as a right of our citizens, not a commodity. There is more work to be done. Let us continue to work hand in hand to guarantee affordable and quality universal access to all Filipinos. Maraming salamat po, and may I ask my fellow senators present here if anyone would like to make some introductory remarks.
Mr. Chairman, I have no opening statement to make except to say that in 1 minute I have to ask your permission to leave because I'll have to attend the Committee on Rules meeting to tackle several resolutions, including your own resolution, PS Resolution number 5, which you introduced. So, by your leave, Mr. Chairman.
Thank you, sir. I'll try to follow also.
Thank you. Thank you very much.
Your next hearing. Thank you, sir.
See you tomorrow.
See you. May we request the committee secretary, Ms. Beatriz Cruda, to acknowledge the resource persons present today. Ms. Committee Secretary.
Mr. Chair, just before she acknowledges, may
Sorry.
I just... No, it's okay. I don't have an opening statement either. I would just like to be given a few minutes later on before we have to go to our 3 o'clock to ask a few questions. Later, just so long as we have a few minutes to do that. Thank you.
Senator Risa, I'm so sorry. This is my second time to preside an organizational hearing.
No apologies necessary, Chair, and salamat kaayo, and good afternoon, magandang hapon sa ating lahat na resource persons. I'd just like to join with the sentiment expressed by the Chair in his opening remarks that as a member of the Health Committee, I continue to look forward to, first of all, as an umbrella, implementing, and as the Senate overseeing yung implementation ng landmark na Universal Healthcare Act. Isa sa mga very good teamwork namin ng dating chair, si former Senator JV, and which I look forward to overseeing the implementation of under our chair, Senator Bongo, and all the colleagues in the committee. And secondly, I'm excited na patuloy na sa ilalim ni Chair Bongo, patuloy na maglikha ng mga piecemeal legislation na pwedeng ipanganak niyang Universal Healthcare Act along those 6 pillars of sa World Health Organization ng pagtataguyod natin in the long term ng isang universal healthcare system dito sa Pilipinas. So salamat po at salamat kaayo, Chair.
Mr. Chair, just one more administrative matter, with your permission. Thank you. I'd just like to commend the Chair and the committee for following the initiative that we started in the session floor that no plastic bottles in our hearings. I really appreciate it because it takes a lot of practice to change this habit. So, and we also want to since this is DOH, we'd like you to be, you will be a regular guest here. May we ask all of those attending to bring your own reusable tumbler in the future kasi the Senate is really planning to be plastic free. Thank you.
Thank you. I'm sure lahat po ng nandito wala pong plastic. Totoong tao po ang lahat ng sumali dito sa hearing natin. Anyway, thank you, Senator Riza, Senator Pia. May we request the committee secretary, Ms. Beatriz Cruda, to acknowledge the resource persons present today. Ms. Committee Secretary, kindly.
Good afternoon. We would like to acknowledge the resource persons for this afternoon's meeting from the Department of Health, Undersecretary Mario Villaverde, Undersecretary Roger Tong-An, Undersecretary Maria Carolina Vidal Taino, Undersecretary Lilibeth David, Assistant Secretary Maria Rosario Vergere. From the PhilHealth, we have Brigadier General Ricardo Morales, President and Chief Executive Officer, Alessandro Cabading, Member Board of Directors, Brigadier General Marlene Padua, Member Board of Directors, and Attorney Jacinto Paras, Dole Undersecretary, Member Board of Directors. Thank you.
Thank you, Committee Secretary. I would like to note that we received a letter from Secretary Duque yesterday informing us that he will not be able to attend today due to national dengue epidemic, which he is attending to. Thank you everyone for attending the first public meeting of the Committee on health and demography. With that, the committee is now ready to start the briefing on the Philippine health situation and healthcare system. The Department of Health will provide an overview of the Philippine health situation and the state of the country's healthcare delivery system. PhilHealth will give a summary of the accomplishments and challenges of the National Health Insurance Program. We will appreciate if the two agencies can provide insights on how we can help address the issues affecting the country's healthcare system. To clarify, this meeting is for a general briefing only. Please let us not dwell on specific issues just yet, as they may be tackled in a separate meeting. We still have session at 3 p.m., so we will allow a maximum of 20 minutes for each presentation, but anytime members of the committee will be allowed to clarify statements made by the resource person. Let's now start with the Department of Health.
Magandang hapon po, Mr. Chair. Magandang hapon po sa mga miyembro ng ating Committee on Health dito sa Senado. The DOH is very pleased to present to you the overview of the Philippine healthcare sector. We divided this presentation into three parts. The first part is the overview of the challenges in the Philippine health system. And the second part will explain the direction of where we would like the health sector to be. And the third part provides the plans and actions that the health sector is currently doing to address these challenges. Now, what are the challenges in the Philippine healthcare system? The first major challenge is our mixed health outcomes. The Philippines has a mixed performance in terms of our health outcomes, with modest gains in some selected health outcome indicators and weak performance in some. Like, for example, for the life expectancy indicator, Filipinos now are living longer, no? Compared to 20 years ago, where we only expect to live 67 years, we now have 72 years as our life expectancy. Some health outcomes also are improving, although slowly. Our infant mortality, there is now less infants dying every day, from 130 a day in 2003 to 110 daily, but this is still a very big challenge. Now, less mothers also die every day, from 6 mothers dying through childbirth in 2012 to 5 in 2015. Now, there are also indicators where we are not performing as expected. Right now, we have about a third of our children being stunted. So this is related to the nutrition condition or situation in the country. And still, 1,600 new TB cases are being detected every day, compared to the previous years, where we only are able to detect 1,200 new cases. But this is also due to an improved technology for detecting our tuberculosis cases.
Mr. Chair.
Senator Riza, you may.
Thank you, Mr. Chair. A quick clarification lang po, Yusek. Yung health outcomes improving on less infants die every day. So ito po yung naabot natin yung Millennium Development Goal on lower infant mortality.
We have
except for newborns, tama po ba?
We have lowered the infant mortality rate, but our biggest challenge is still the neonatal death rates, which is a component of the infant mortality rate. Nagbababa yung total ng infant mortality, but the first 2 days after birth is the biggest challenge. So ito yung may kailangan tayo sigurong reviewin sa ating mga policies at sa ating mga programs and services, because this is now where we get most of the infant death in the first 2 days of life, no? So yung bagong batas na yung the first 1,000 days may also help in the reduction of this particular stage in the development of a child.
I hope so. Thank you, Yusek. Thank you, Chair.
Now, these poor health outcomes have led to the Philippines performing relatively poorly when compared to our Southeast Asian neighbors. For the indicators of average life expectancy, maternal mortality ratio, and infant mortality rate, as well as the TB incidence rates, the country comes in at the middle or towards the bottom of the 10 ASEAN countries, including yung Timor-Leste, which is has an observer status in the ASEAN. Now, the next major challenge is actually the fragmented health system, which was brought about by the devolution about 2 or 3 decades ago. Ano lang yung, yan, okay. So the enactment of the Local Government Code in 1991 led to the dual governance in health, with the DOH governing or managing the health system at the national level, and the local government units at the subnational level. Now, the DOH serves as the overall steward and technical authority on health, being the national health policy maker and regulatory agency of the government when it comes to health. It is mandated to develop national plans, technical standards and guidelines on health. It is also in charge of licensing hospitals, laboratories, and other health facilities through the Health Facilities and Services Regulatory Bureau, and for health products through the Food and Drug Administration, with PhilHealth automatically accrediting DOH licensed facilities. The DOH also supervises government corporate hospitals, yung 4 po na hospital, which we call the specialty hospitals, as well as the regional hospitals and medical centers. On the other hand, the LGUs are in charge of the delivery of the both primary and secondary health services at the subnational level. This is in response to the fragmented archipelagic nature of our country and the uneven distribution of our population. Now, LGUs prepare plans as well as manage and implement local health programs and services. The Local Health Board, which consists of selected and appointed members, enjoys advisory powers, planning authority, and responsibility for the health services. The provincial governments, on the other hand, manage the district and provincial hospitals, while municipal governments manage the rural health units or health centers and the barangay health station. But generally, the LGUs will be in charge of primary care, including preventive and promotive health care and other public health programs through our health centers and our primary level hospitals. The next slide will show you another challenge. This is in terms of the duality of our health system, where we have both the public sector and much bigger private sector. The Philippines has a mixed public-private healthcare system that operates within this fragmented environment. As I have mentioned, both the national government and the LGUs manage the delivery of promotive, preventive, curative, as well as rehabilitative health services in the public sector. But the private sector, which is far larger than the public system in terms of its financial resources, as well as in the number of health facilities and hospital beds, no? In the last decade, the private sector has already overtaken the government in terms of investments for more hospital beds. Dati po, opposite siya. Mas madami dati yung government hospital beds, but I think in the last 5 to 7 years, medyo na bago na po yung condition. That means the private sector is now investing more in terms of the delivery of hospital services. About 65% of the 1,224 hospitals in the country in 2016 were private. And in terms of the number of beds, the private sector already has more than 50% of the total hospital beds in the country. Nandun po ito sa ating table. Now, despite the private sector having more facilities and beds, the government health facilities remain overcrowded. The following are some of the reasons why this is happening, particularly in the Department of Health.
Mr. Chair,
Apa.
before, I'm following your slides. Before he goes to the next point, may I already ask my question? Because this has to do with your first challenge. Okay? Let me refer everyone to our newly passed law. Well, actually, I'm referring to the implementing rules on for PhilHealth. No, this is the draft rules. It says here in section 17.1, the Department of Health shall endeavor to contract province-wide and city-wide health systems as defined in section 19 of these rules for the delivery of population healthcare services. My staff attended the briefings the past, I think there was one in CDO and one here yesterday. And the question was asked, she was just an observer, are the cities and municipalities required to join the primary care provider network of the province? And the answer given, I won't ask question and answer, mas hahaba pa eh. Sabihin ko na lang kung ano yung nandun, no? The answer given was, based on the IRR discussions on August 6, the cities and municipalities are not required to join and may opt out of the network. However, if they do so, they will not have the access of the provincial network. Mr. Chair, this is a big problem as far as I'm concerned, because when we look at the delivery of health services, we all know that it's a grassroots, right? So we have the municipalities, the cities, and the provinces. And we all know in politics that the provincial governor and the mayors are not always on the same side. And although we can always point that it will be a violation of law, you can file charges against them, at the end of the day, tao ang maghihirap kung hindi makadeliver ang services. So based on this answer given yesterday, August 6, I have a big problem because if we implement this, there really will be municipalities and citizens of the Filipinos that will be marginalized because of the realities that the provincial governor and his officers may not necessarily be working hand in hand with the municipalities. Now, if I look back at the draft of the rules, again, it's just a draft, shall endeavor to contract province-wide and city-wide health systems. That does not mean that it has, the be-all and end-all is the provincial government's office. Because my next point is, which is where you're talking about the private and public partnership, apparently, based on the discussions also, PhilHealth wants private networks to have political boundaries. But the reality is, you just told us that most of the health services are now being delivered in terms of number of establishments and bed capacity by the private sector. So, Mr. Chair, if you will now put boundaries on the private sector working to provide these services, then again you are depriving the Filipino people, especially in areas where there is no public sector. Now, let me get my point straight. Obviously, government has a big job to do. We have to roll out more services because private is private, it's for profit. So, wala tayong question doon, right? We all agree that we have to have more public establishment. But the reality right now is we don't. And then babawasan pa, lalagyan ng political boundaries. So, the example that I have for you is, for example, I don't know this group, okay? This is just a memo given to me that, I won't mention the name na lang. There is one particularly group of health services. There's a hospital group that have a network all over Metro Manila. And then sasabihin nyo, bawasan yung access niya. Bakit? Eh kung nakaka-deliver naman siya, ba't babawasan? And then I go back to my first question, the provinces. I have a problem with that. I need that resolved because what I was told is that by hook or by crook, i-implement na daw to. Mr. Chair, ang laking problema nun. Dahil we will have all these municipal mayors coming to us and telling us, normal problem, delivery of medicines, right? It was in the news the other day that we have so much medicine expired, correct? Logistics is a problem, it is a reality. So, madaling magpalusot yung provincial government. Sabi nila, hindi lang na-deliver. Pero sa totoo lang, inetsepuera niya or hindi niya pa-prioritize yung municipality niya. So, I rest my case. That's a problem. You need to resolve it because it will not work this way. Thank you, Mr. Chair, for allowing me to say that, please.
Thank you, Senator Pia, for pointing that out. Kailangan talaga kabalikat at kasama lahat ng LGU's health service delivery. At kindly po sa DOH, pakitutukan po ito at pag-aralan yung mabuti.
Pabalikan, no, Mr. Chair, no? In about a week's time siguro. Para naman alam natin na...
Yeah, may I respond to that? Kasi the implementing rules and regulations is still in its draft form, and even in its draft form, you can already see that the very foundation of the province-wide and city-wide health system is the primary care level of health services. And that is founded on the current health centers and barangay health stations, which are under the management of the municipal government. So this might have been overheard during discussions and questions and answers, but in the write-up, it is really there that the municipalities and the cities will be part, or I mean, the health centers and the barangay health stations, including the primary level hospitals up to the tertiary level hospital, will be part of the province-wide and the city-wide health system.
I did not include that in my explanation, my statement, because the reality is it still won't work. I mean, I can name to you how many provinces that just in the last election that kalahati ng municipal mayors kakampi ng provincial governor, yung kalahati hindi. Or majority, paano yung minority? It is a reality. PhilHealth and DOH have to realize that. It is a reality in life. So you cannot just say that this is how it will work. What I'm saying is, can this network not work without having to bring it under the umbrella of the provincial governor? That's what I'm personally trying to ask you to explore. Because on its own, you can have that network within the health systems. Why do you have to make it political? You know very well, you've heard all the stories about pipilahan pa yung gamot sa office ng mayor, pipila. So why would you want to create that on a bigger scale? Because that is what's happening. You're creating that whole problem on a bigger scale. Why don't you just allow this network to flow and have PhilHealth and DOH oversee that? Because that's what you're supposed to do.
Yeah. Actually, that's the flexibility being offered to us by the Universal Healthcare Act, and we are actually pursuing the different potentials under this law. That is the reason why we are trying to construct the implementing rules with some flexibility for this.
And I like your answer. Your answer is totally correct. But that is not what came out of the discussions yesterday. Ang sagot was, yes, the cities and municipalities are not required to join. They may opt out. However, they will not be able to access the resources of the provincial network. So that is not, I like your answer, but that is not what was said yesterday. And I can tell you that no less than the chairman of the Committee on Health in the House of Representatives also has the same answer. So we have a problem with what you're explaining to us, because if I did not know this, I'd be okay na with the answer. We could move on. But the thing is, I know what was said during the discussions, and I've also been in direct contact with Chairman Helen Tan, who's also a doctor. So on that note, I rest my case. I don't want to take it further. We can talk about it, but it's not solved, because what you're saying is different from what is being discussed on the implementation, and that's what counts. Because once this is signed, this is what's going to be followed, not what you said in this hearing. Mapapatawag lang tayo ng another hearing, which is not what we really want to do. Thank you, thank you.
Mr. Chair.
Yes, Senator.
Salamat, Mr. Chair. Ayoko ring patagalin, but just to add a point dun sa sinabi na ni Senator Pia, naalala ko nung bicameral conference committee meeting dito sa Universal Healthcare Act. And I would also expect, like Senator Pia, na yung ilalabas na final IRRs will be faithful to the spirit of the act itself. I actually remember, itong puntong ito was one of the most important reforms, institutional and even financial reforms introduced sa Universal Healthcare Act para nga i-address yung sinabi nyo, Yusek, na fragmentation ng health system na mayroong iipuning resources at the provincial level para i-rationalize yung delivery of health services sa mga constituents sa baba while retaining yung direct management ng tertiary level health facilities under the DOH. So na-appreciate ko talaga yun nung panahon ng BICAM, and I'm really looking forward to na maipasok talaga sa IRR. In fact, yung problem na pinoint out ni Senator Pia, yung politicization, can actually be addressed, even resolved, kung tamang i-implement ito. We know that kung kalahati man yon na hindi magkaalyado yung mga local government officials at the local level. Pero kaya ganun ka-importante yung papel ng DOH, kasama na yung PhilHealth, na to develop that professional bureaucracy na anuman yung administrasyon sa LGU level, this universal healthcare system will be delivered at a high level of quality sa mga tao. So, just to add na importanteng reform yan, I hope you will stick to your guns. DOH will continue to stand up for it at yun pa rin ang lumabas dapat sa IRRs. Salamat, Mr. Chair.
Let me continue with the next slide. The third major challenge is the high out-of-pocket expenditure. The total health expenditure now in the Philippines has nearly doubled since 2010. It now amounts, this is the total health sector expenditure, both public and private, amounting to 655 billion in 2016. This is the latest that we have from the Philippine Statistics Authority. And there is now significantly more money in health than ever before, and the total health expenditure is set to keep growing. However, most of the money in health comes from out-of-pocket spending, which expose Filipinos to the financial burden of accessing healthcare. In fact, a World Bank study in 2014 states that 1.5 million Filipinos were pushed to poverty from accessing health services. And this is despite of the higher PhilHealth coverage and the pro-poor schemes such as the no balance billing policy. Now, overall, the data shows us that there have only been marginal improvements in health outcomes, despite meaningful increases in financing for health. This is coupled with inequity in access to health services across geographic and socioeconomic divisions. Furthermore, the fragmentation of the health system due to the devolution has led to a blurring of roles and accountability in the health sector, where responsibility is often passed between different government agencies. The overlapping and sometimes conflicting mandates of the DOH and the LGUs on health, owing to devolution, led to the disintegration of the originally integrated referral system that linked public health services with our hospital services. Decentralization was pushed too far, leading to the fragmentation in service delivery as far as its health unit was inefficiently assigned to a different local government rather than keeping the integrated health system in place. Now, out-of-pocket payment remains to be the major funding source of financing for health, which can create barrier to healthcare access, especially among the poor and the near poor. So, where do we want to go? Our overall framework...
Mr. Chair, may I just clarify? Because in the copy of the presentation that we have, after the challenges, you have a summary, no? Which the summary is basically you repeated the challenges. And then after that is the where do you want to go, which is where you're going now, right? But I just went fast forward due to time constraints, no? Yung where do you want to go are very general ambitions and dreams for the Filipino, which of course we want, no, healthier Filipino, longer life, etc., etc. Pero can you go back to how to address those three challenges? Kasi I haven't really heard the specific roadmap to addressing those challenges.
Actually, ma'am, the basic document that we are following is based on the Philippine Development Plan, which we have interpreted on the part of the health sector through the National Objectives for Health, the F1 Plus for Health, which is the medium-term plan. And now this is supported by the enactment of the Universal Healthcare Act, which
Okay.
actually provided the legal mandate now for us to pursue what was written in the National Objective for Health and the F1 Plus. Now, the details of this, including our indicators, performance indicators, and our goals up to 2022, because this is the time frame of the medium-term plan, is written in that thick document. Now, we were told, this is the
Okay.
document, ma'am.
So it's there. So,
Opo.
and obviously there's not enough time to go into
Yes,
it. So,
opo. Kaya medyo
no
summary na
problem.
lang ito
May
po.
I just
Oo.
request then, Mr. Chair, na ang gawin natin, yung tatlong challenges na binanggit mo, can somebody give us a memo kung
Opo.
saan indicate lang kung saan namin hahanapin dyan sa
Ah,
makapal
yes.
na yun yung answers? Kasi it's the kind of work naman that we have to do
Yes.
outside of the hearing, and then we
Opo.
can come and question you again.
Opo.
Kasi, for example, yung unang challenge mo, yung mixed health outcomes,
Opo.
di ba? Eh kami ni Senator Risa, because of our work with mother and children, concerned talaga kami dyan kung
Yes.
yung ating maternal mortality rate and infant mortality rate na-address. Ang binanggit mo kanina, we still have a problem with the babies dying in the first 2 days. Mr. Chair, I think we would want this to be emphasized, hindi nyo nabanggit, pero priority ni Presidente ang reproductive health. He has made that announcement so many times.
Yes.
And if you look at infants dying in the first days of their life, that is directly related to reproductive health and the health of the mother.
Yes, of course.
Diba? Because most likely, either she had preconditions that prevented her from having a normal delivery, or the baby was not healthy, or she does not have access to a health facility that has the specialized care that she needs, correct?
Yes,
Hindi po ako doktora, pero sa ilang years ko nang nag-aaral ng maternal and infant care, yun yung understanding ko. So on that note, we need to understand that carefully and exactly what you are doing, because if we need to provide further support for this, I know very well that the chairman will ensure it, because he knows that the president, we all know that it's the priority of the president. Another example that I want to give to emphasize that point is if the need is specialized doctors, right, at some point, do we have enough in the country that will go into our human healthcare resource management, di ba? Kung sasabihin nyo na hindi kaya ng BHW yan, hindi rin kaya ng nurse yan, hindi rin kaya ng general practitioner, o di therefore we need pala more specialized practitioners, and we might need to give them incentives to practice in the far-flung areas. We don't know that. We need to know that so that
Yes.
yung objective ng presidente na yung reproductive health and just to put it straight to the point, yung nanganganak ng 8 beses, are they at the prime of their health, or are they further at risk? Yung nanganganak ng 16 years old, di ba lahat yan mga at-risk pregnancies? So that we need to know this so that we can provide the appropriate support and budget. I just want to emphasize that because I know it's the priority of the President, Mr. Chair.
Opo.
Thank you.
Nandito po naman po sa mga
I-memo nyo kami
objectives.
para
Opo.
we can
Opo.
study the right
Yes,
provisions.
yes, ma'am.
Kindly submit to the committee a report on this next week, Yusek Villarde.
Opo.
Anyway, let me acknowledge Senator Bato de la Rosa, so a member of this committee. You have any question, Senator?
Mr. Chair, mamaya, makinig muna ako.
Sabi niya kanina, bakit daw walang pukpok dito? Sa kanya daw, nag-request daw siya doon ng pukpok. Tad-tad yata ng chicharon yung ginamit mo. Anyway, let's continue on your presentation.
So now, the next slide will show you the overall vision of the Department of Health for the entire health sector and for the Filipino people, no, that the Philippines be a prosperous and predominantly middle-class society enjoying long and healthy lives, you know. And for the health sector, we have the Formula 1 Plus for Health as our rallying call for boosting universal health care. No? So the vision is that Filipinos are among the healthiest people in Southeast Asia by 2022. Now, the Formula 1 Plus for Health has 5 pillars. This is the one written in our medium-term plan. And the first pillar is, of course, financing, anchored on universal health insurance coverage. We also have the second pillar, which is service delivery, where we would want to improve the package of health services that we deliver to our constituents, including improving our service delivery networks. In the case of the universal healthcare, this now becomes the province-wide and the city-wide health system. And then we have also the regulation, health regulation pillar, to ensure that we have high quality and affordable health products and services. We also included in this framework the health governance pillar, which concerned with strengthening the leadership and management, as well as delineating or clearly delineating the roles and responsibilities of the major stakeholders in health. Now, lastly, the Secretary of Health initiated a performance accountability cutting across all the different pillars, so that we will be able to really evaluate, assess, and account for the performance of the major stakeholders in health. Now, in support of this initiative and the medium-term plan that we have been implementing, more recently, the Republic Act number 11223, or the Universal Healthcare Act, was signed by our President on February 20. It marked a beginning of a new chapter in the reform of the Philippine health system, and this will shift the health system's current treatment-oriented approach towards a more balanced approach, emphasizing prevention and health promotion, and emphasis on primary care. Now, the UHC Act is envisioned to ensure that all Filipinos are able to access quality and affordable health services that they need without exposing to financial hardship. Now, aside from this major legislation, the DOH actually have also discussed what other priority bills will need to be discussed by the new Congress, and we will be providing, I think our DLLO has already provided a copy of our priority bills, which are listed here. So we will summarize this according to the pillars of our F1 Plus. So we have proposal for, let us say, financing, for the service delivery, for the regulation and the health governance pillar to improve further the delivery of health services. And this is what I think was earlier said by Senator Hontiveros, that piecemeal legislation will still need to be enacted to support the implementation of the Universal Healthcare Act, because the Universal Healthcare Act is quite an omnibus bill for the entire health sector, but more detailed sectors or aspects of healthcare delivery, we still need some further legislation. Magandang hapon po.
Thank you, Yusek Mario Villarde. Before we proceed to the presentation of PhilHealth, I have some questions regarding the dengue outbreak. The Department of Health declared a national dengue alert on July 15, and as the number of dengue victims continue to rise dramatically, ano na po ang status ng dengue outbreak sa bansa, ano po ang mga hakbang na ginagawa ng ahensya ng DOH upang masolusyonan po ito sa ngayon?
Oh, Mr. Chair, may I request ASEC Rosette Berhera to provide you with the status of the dengue outbreak?
Good afternoon, Mr. Chair, and good afternoon to all the senators. Just yesterday, sir, the Secretary of Health, together with the Secretary of National Defense, have convened the National Disaster Risk Reduction and Management Council. And together, they have signed this resolution and memorandum circular wherein the Department of Health has declared that there would be a national dengue outbreak. Currently, we have around 146,000 cases with 622 deaths. And there are around 7 regions now reaching that epidemic threshold. And about 14 out of 17 regions now have reached that number of cases higher than the number of cases last year. So we have ask the help of our partner agencies through the National Disaster Risk Reduction and Management Council so that we can mobilize support from other agencies. We all know that number one or critical to dengue would be source reduction. That is reducing the source of the infection, which are the mosquitoes. So we have asked the help of our partner agencies in the national government so that they can mobilize their teams as well. Like for example, the ILG already has issued out memorandum circular to all LGUs that they are compelled to do the 4 o'clock habit. They have to activate their ABACADA, which is the Action Barangay Contra Dengue. The DepEd has also issued out circulars to all their schools for the cleaning activities and the wearing of children with these long sleeves and long pants. And the other agencies also helping us. Philippine Red Cross also helping us with the provision of blood products to our regions. So we have already also pre-positioned commodities and funds for our region so that we can better respond to this epidemic, sir.
So sa ngayon, ano talaga yung prevention ng dengue sa ngayon?
Sir, as
Yung
4S, sir.
4S.
So we have 4S. That is the main strategy of our dengue program. 4S is first, you search and destroy breeding sites of mosquitoes. The second would be self-protection. So you protect yourselves by wearing long sleeves and long pants and putting on insect repellents. The third is seeking early consultation. So ngayon po, base po sa datos, marami pong nauuspital o nagkakaroon ng bad outcome kasi late na ho sila magpakonsulta. So we're trying to inform the public that the una pa lang na senyales na may ganitong sakit o naglalagnat pa lang ang bata, pumunta na sa pinakamalapit na health facility. That's seeking early consultation. And the last is we support fogging operations if there is an impending outbreak. So that is the 4S strategy, sir.
Ano ba tong dengue? Seasonal ba talaga to or anong panahon po ito na dumarating sa isang taon po?
Sir, before, it was seasonal. Sinasabi decades ago na dumadating lang siya, especially kapag katag-ulan. Pero ngayon po, endemic na po ang dengue virus dito sa Pilipinas. So if you'd look at our records now, our data for the number of cases, you'd find that even as early as January, we already have that peak of cases. So meron na ho tayong dengue talaga all throughout the year.
What is your timetable to contain this epidemic or how soon can we expect a decrease or dramatic decrease in these cases po?
Actually, sir, that was asked from the Secretary yesterday, and we are predicting na hindi pa ho ito yung peak natin ng number of cases. Our epidemiologists are saying that by October, baka mas tataas pa yung kaso natin. Hopefully not, but that is a prediction and an estimation based on models. Pero tinitignan po natin na paglabas po ng rainy season, hopefully the cases will go down.
Thank you.
Mr. Chair, quick question lang po.
Okay, you may.
My chief of staff who's from Bohol was recently went home and she was talking to some health officials there, and they noted that there are a lot of cases where you can see the difference between a child who is generally healthy and a child who is malnourished. Mas malaki yung chances na namamatay yung mga malnourished children. So it brings me back to many years ago, I was in a health conference with some experts on HIV/AIDS. And they were also explaining to me that at the end of the day, it's your immunity system that will fight that. So to bring up the level of health of every child is the first thing that we can do to help them fight this battle. Is that correct?
Yes, ma'am. We agree with that. Actually, dun po sa mga information materials namin, lagi po namin pinapaalala na ang isang malakas na tao or healthy na tao, hindi siya
Mas
madaling
malalabanan
dapuan
niya.
ng ganitong sakit. Yes,
So,
ma'am.
but I think that's very critical kasi hindi ko rin naisip yun nung hindi pa niya binanggit sa akin ngayon lang. Hindi ko naisip yun and I don't really hear it repeated. And it is one reason, it's another reason for us to really combat. You mentioned no, that there were areas in your presentation, Yusek, that there are really areas where talagang the nutrition level of the children are still very low and we have stunted growth. So yun pa lang baka kung, I mean, that one is a long-term solution. It's not something you can address in an epidemic. Pero I think that gives us even more reason to address that because we cannot wipe out dengue in a day, in a year, but we can make our children healthier with a more well thought out and more resources. So I think that's very important because this goes into the feeding programs, the pantawid, and immunization, etc., etc. Thank you.
Mr. Chair.
You may, Senator
Thank
Risa.
you, Mr. Chair. Earlier today po, Mr. Chair, I called on government to institute all possible strategies. So, pangunahin na yung sinabi ni Asek Vergere na 4S strategy ng Department of Health. All these possible strategies and explore other interventions that would protect all Filipinos from this public health emergency. And I'm hoping po, Mr. Chair, sa pamumuno nyo ng komite natin dito sa Senate, we can also add our voice dun sa partner sa executive na talagang all-out protection sa mga Pilipino, lalo na yung mga bata, mga senior citizens sa epidemic na to. And lastly, I called earlier today for an end to the scaremongering and promotion of pseudoscience, mga ganyang antics na nakasasagabal sa health interventions ng Department of Health and leave us even more vulnerable sa predations ng ganitong klaseng epidemic. So, salamat, Mr. Chair.
Thank you, Senator Risa. How about yung, I heard, is there any technique sa mga doctors? Sino pong doctors dito? May mga technique ba yan sa, tanong lang, kasi since halos natakot sila sa immunization, meron bang technique dyan? Sabi nila, dagdagan ng tubig, ng sa dextrose? Wala.
Wala po, sir, na technique, but the main goal for us when we have our patients confined in the hospital is for us to hydrate them because primarily the patients lose out their electrolytes and fluids because of the process of dengue within the body. Pero wala naman pong technique para dyan. Ang isa pa hong importanteng malaman, wala pong gamot para sa dengue. So kapag kinonfine natin sila, sinusuportahan lang ho natin sila through hydration.
Hydration.
Yes, sir.
Okay. Okay, you may, ma'am.
Thank you, Mr. Chair. Dahil nabanggit na rin ng Chair yung halos natakot sa immunization yung ating mga magulang, sana po ay sa pamumuno din ninyo dito sa Senate Committee on Health, we can call on our people na i-restore yung confidence sa expanded program on immunization ng Department of Health. Kasi hindi lang sa dengue nangyari, pati ba sa measles na dati halos natin na eliminate, Mr. Chair. Pero dahil sa takot sa immunization na binanggit na nga ng Chair, pati sa ibang sakit na takot magpaturok o magpabakuna. And now, even before this dengue outbreak, we had a resurgence of the measles epidemic. Sobrang nakakalungkot talaga because all the decades of work ng DOH at ng ating mga pediatricians na gawing second nature sa ating mga magulang, pabakunahan yung ating mga anak sa mga easily preventable diseases. And alam po natin, Mr. Chair, in the past many months, literally nag-house to house yung mga DOH at the local level para lang i-reassure yung mga magulang na dun sa mga napatunayan ng mga bakuna sa mga easily preventable childhood diseases ay dapat talagang magpabakuna. A simple, life-saving preventive action. So, muli po, Mr. Chair, I'm hoping yung ating komite will also lend our voice and support na manumbalik yung kumpiyansa ng publiko, lalo na ng mga magulang, sa expanded program on immunization ng DOH. Thank you, Mr. Chair.
Thank you, Senator Riza. Ako naman po, ma'am, based on experience, ako rin po yung before, let me acknowledge first Senator Tolentino, another member of Committee on Health. Based on experience po, last year po, sinubukan ko rin pong ako yung magpa-bakuna. Flu vaccine po yata yan. It's a year-long naman free immunization. At ini-encourage ko rin po yung publiko na magpa-bakuna at huwag pong matakot. Just like what Senator Risa said. Ako naman, maging maayos naman po yung resulta. Kaya lang pag injection sa akin dito, sa Malacanang yan, hindi yung, ang nangyari, isolated case yung nangyari sa akin. Tinamaan daw yung, nung nag-injection sa akin. So, 2% ano lang yan, possibility na mangyari. Tinamaan, so, nagkalagnat ako, nag-abroad kami sa Cambodia ni Presidente. 40 yung ano ko, kala ko. Pero yung pala tinamaan daw yung mali yung pagka-injection. So, medyo malas lang po siguro ang inabot ko. Sino ba yung doktor na yun? Sana yun? Tag-DOH sa dinala ni Secretary Duque. Ikaw muna, buti hindi si Presidente. Gusto niya si Presidente ang sampulan. Sabi ko wag kasi because we are traveling. So ako na lang. So pagdating namin sa abroad, umabot po ng 40 yung fever ko. Dahil as in magang-maga yung pulang-pula rito. Nagkamali daw ng technique. Anyway, kumusta mo na lang ako doon sa taga-DOH. The expanded program on immunization, let me tackle on immunization program. The expanded program on immunization seeks to ensure that children, particularly infants and their mothers, have access to vaccines recommended for their age to prevent specific diseases. Ano na po ang status ng ating national immunization program and how can we improve the percentage of fully immunized infants at ano po ang strategies ninyo dito po? Because we are very much interested po dito sa ating immunization program, lalong-lalo na po ang publiko.
Yes, sir. Our expanded program on immunization has been suffering this very low trends for the past year. So we have tried to analyze our data. Tinignan po namin hindi lang since 2015 but starting off since 2010. And we also are using studies coming from international partners like WHO and UNICEF, where it states in the studies that the confidence of people in the vaccine has really gone down. We were enjoying around 80 to 85% confidence in the vaccination of DOH in the early 2014, 2015. But during the next survey for 2017, it went down to just 20 and 15 to 20%. So this is one of the reasons. But of course, we are not just relying on that and basing it on that confidence level, but also looking at the other factors which hampers our immunization program. Like, for example, the lack of health human resources at the ground also contributed to our immunization status. Also having these isolated areas or the far-flung areas in the country. So all of these factors, and these are multifactorial, that had been contributing to this low trends in our immunization status. Though when it comes to resources, we have invested a lot already for the expanded program of immunization for the Department of Health.
Mr. Chair,
Okay, you may.
may I briefly respond? ASEC, are you the one in charge of promotions, or are you just sharing that with us? Health promotions?
Yes, sir. Yes, ma'am.
Okay,
I am.
Perfect. Thank you for the information that you provided. I'd like to also put this into context. When I became a senator in 2004, the status of our immunization was that we were reliant on foreign donations for some of our immunization, and I particularly remember hepatitis B. It just happened to be an advocacy of mine because my father had hepatitis B. And we had to pass that law precisely because we wanted to ensure that the budget moving forward would include a complete budget for the vaccinations. Because if we were reliant on foreign donation, it was running out in a year or two around that time, then there would be no more budget for the vaccination. And we got that done. Although the law, it did not become a law till about 5 years after I filed the bill, because there was actually a member of the Senate at that time who was anti-vax. But nevertheless, because of the attention that we were able to bring because of the hearings that we had, it was already included in the budget. So we were able to cover that. Fast forward, here we are, as Senator Risa pointed out, we have so many mothers who refuse to have their children vaccinated with measles and so many other vaccines because of the dengue scare. And it just so happened that this was going around in the last few months where we were all on the road, the three of us. And so I had the opportunity to talk to barangay health workers all over the country. And you did mention that one of the problems is far-flung areas, but really the biggest problem of them all is that mothers were scared. Mothers were scared to bring their children to be vaccinated. What solved it? You know what solved it? Because babies started to die from measles. They died, and then suddenly the mothers were now rushing because they realized, okay, my kid is now going to die of measles too, I'll have them vaccinated. And then naubusan naman ng measles kasi there was this big surge. So my point is, we have a budget through the sin tax law that we also passed years ago for health promotions. And I may not have seen it, but I would like to see, and I have yet to see, really exciting and engaging infomercial cartoons, dramas that would help mothers really appreciate the importance of vaccination. Because we've seen the kind of problems that we can face. We can have well-educated mothers who don't believe in vaccine, and you've seen this problem all over the world, right? Even in developed countries. But then you have mothers who are not educated who simply saw the reality that there were some children who died, supposedly affiliated with their being vaccinated with dengue, and they jumped to the conclusion that all vaccines are harmful. My point is, health promotions, the budget is there. Let's really make this engaging. Kailangan kasing dramatic ng teleserye, kasing nakakatawa ng kung anong comedy dyan. That's how it has to be to really get through the point so that mothers understand. Thank you.
Thank you, Senator Pia. I'm so sorry, but it's already 2:26 and we have a session 3 p.m. May I ask PhilHealth to proceed with its briefing, pero wala na siguro tayong time magtanong. Maybe tomorrow you will also be invited po sa Blue Ribbon Committee hearing. Right now, before you proceed with your presentation, one more last question and very important concern. How will the DOH and PhilHealth address the current problems that beset their agencies? Ito pong how will DOH address the issue of near expiry medicines that have not been distributed earlier? Po, last question lang po. Very much interested po ako dito.
We have Yusek Taino to answer that.
Good afternoon, Mr. Chair, and all the members of the Senate. Well, regarding the inventory on drugs and medicines that was advertised or printed in the media that they were expired, as of this, as to date, we have already an allocation of the metformin and the micronutrients, but all the rest are we have a zero balance for that as of inventory August 5. So we have two commodities. The metformin, we have an allocation for the hospitals, and for the micronutrients that will be delivered to the DSWD as a supplementary feeding program. That's it, sir.
Thank you. And siguro it's high time na rin po siguro magkaroon kayo ng maayos na sistema sa distribution system ninyo para wala pong masasayang na gamot at hindi po umabot sa, alam niyo, pag yung Pilipino minsan ay mahilig tayo sa last minute, kaya lang pag nakita na rin natin malapit na rin mag-expire, ayaw na rin na tanggapin. So maybe you can improve your distribution system or may magprograma po kayong gawin tungkol dito.
Mr. Chair.
You may, ma'am.
Salamat, Mr. Chair. Maikling dagdag dun sa sinabi ni Chair. Dagdag dun sa distribution system, baka pwede niyong i-inform yung committee, submit the document through the Chair, in terms of yung kompleto yung inventory. Kasi dalawa lang yung binanggit nyo, metformin for diabetes and then micronutrients, essential yon sa first 1,000 days nutrition program natin. Pero ano ba yung baseline dapat? Is it the national formulary? Kung ano po yung baseline nyo ng mga necessary supplies na dapat may inventory ang DOH, baka pwedeng, Chair, isubmit sa committee natin, and then yung status ng bawat isang yon at yung mga plano nyo to make up the shortfall in supply. Thank you, Mr. Chair.
Yes, sir, we will provide you all the documents regarding the inventory of these supplies.
Thank you, Sec Taino. To PhilHealth, you may proceed with your presentation. Kindly, General Morales, sir.
Thank you, sir. Honorable Christopher Lawrence God, the Chairperson of the Committee on Health and Demography, Senator Cayetano, Senator Ontiveros, Senator Tolentino, good afternoon. Thank you for this opportunity. Please allow me to go quickly through the briefing on PhilHealth. PhilHealth, as we know, was created in 1995 by Republic Act 7875, and it assumed the administration of medical